Good day, Dr. Ruckle here. Today I'm going to talk to you about DMSO. What I'd like you to do on this video, if you would subscribe, like it, and share, I would appreciate it. Thank you. So what is DMSO? It's a solvent that easily penetrates the skin. It's known as dimethyl sulfoxide. It's comprised of two methyl groups and an oxygen atom bonded to sulfur. This simple chemical and its breakdown products exist in nature, can be found in small amounts in milk, tomatoes, tea, coffee, beer, clams, and cooked corn. In the body, DMSO is then oxidized or broken down, with the oxidized form being methylsulfonylmethane, or MSM, common joint healing supplement that I actually take on a regular basis. While the reduced form DMS is the metabolite responsible for DMSO's characteristic side effect, which can be a distinctive garlic or clam-like odor or taste that is excreted through the mouth and skin. This effect typically lasts a few hours, but appears to be reflective of the overall health of the body, since as people detox, their DMS odor decreases. Lori and I have not noticed this so much, probably secondary to our clean diets and years of detox protocols. It is a smart drug and knows what to do to create healing and equilibrium in the body. It has two remarkable properties to it. It acts as a near universal solvent. In other words, it interacts with a wide range of biomolecules, can easily mix with any concentration of water. And it's able to pass through biological or cell membranes without damaging them, which is rare. Because of this, DMSO will rapidly enter the body, including the brain, regardless of its route of administration. So example, within 5 minutes of going on the skin, it can be found in the blood, and within an hour, it can be found within the bones. Simultaneously, it does not accumulate within the body after prolonged use, and virtually none remains a week after administration. DMSO in turn has an almost endless supply and amount of uses, as it can be applied in almost any manner. It is frequently applied through the skin, although less is absorbed in this manner than the other routes of administration, such as orally or through IV administration. Almost any drug or substrate can be combined with it and administered through the skin. Examples would be steroids, non-steroidal anti-inflammatory drugs, antibiotics, antivirals, vitamin C, hydrogen peroxide, or chlorine dioxide. In many cases, the effects of these drugs or natural substances are enhanced, and simultaneously their toxicity is typically reduced. This is a drug that was used widely in the 1960s and then fell out of favor. Refer to a Midwestern doctor post that I put in Substack to read about this more. There can be, for us, an itching and tingling type sensation for about 3 to 5 minutes after application. There's not really that garlic or clam-like taste for us. You can combine it with other natural substances and it will naturally drive into the system. I'll show you a few that I use. My favorite is probably Lily of the Desert aloe vera gel. I use this daily. I use it as an aftershave, use it on all parts of my body. And a lot of times I'll follow this with the DMSO. I will use Tiger Balm. And Tiger Balm is an analgesic balm. Think of it like natural Bengay. And I love the way that makes my body feel. Another real nice one is Dr. Scholl's American Botanical Pharmacy Deep Tissue Oil. Very similar, but different from Tiger Balm. I've been experimenting. I took Medi-herb celery seed and chamomile extract, put it into a bottle. I've started to drive this in. Celery seed's a natural anti-inflammatory, and chamomile is a natural calmant, relaxant for the body. I'm going to experiment with hemp oil, possibly ginger. I haven't done those yet. And hydrogen peroxide 3% to drive and oxygenate the tissues. Another one you can use is Traumeel homeopathic trauma cream or an arnica cream. The DMSO I use is DMSO. We're using 100% gel. You can get it at DMSOstore.com. So whatever you want to drive into the tissues, the area should always be cleaned beforehand. So we typically do it after a shower. You could just wipe down the area if you wanted to. What we've seen, and personally what I've seen, is less low back pain and right shoulder pain, able to play pickleball more often. I'm going to experiment with my left ankle that I sprained numerous times when I was younger playing basketball. So there's some chronic scar tissue in there, so we'll see what it does for that. So as you put it on, it'll work systemically into the body and have influence on internal organs. Research points to things like it being used for various eye or ear conditions, neurological conditions. Actually, I noticed less itching, and it seems to be like 2 times the effect with the deep tissue oil and the Tiger Balm. Less low back pain, quicker recovery from pickleball, like I told you, less pain and discomfort overall. It seems like I don't have to stretch as much. So the Boy Scout motto is be prepared, and you want to have it on hand. I suggest potentially for a lot of people using it daily, but at least you want to have it on hand for some of its amazing first aid properties. So it's going to go in my natural first aid kit. There's a 70-30 water Medi-Gel that's sold at the DMSO store. That could be a potential starting point for someone. Again, we use the 100% gel. So gel holds the advantage of continually releasing DMSO into the body over a prolonged period of time, and it's much easier to apply. A little bit goes a long ways. The oral is stronger. I have some ordered. I haven't started experimenting with that yet. I'd suggest a glass bottle here because of its solvent abilities. They seem to sell it in a form of plastic that is approved, but again, I would prefer the glass. So it's suggested to start a small topical application and then try oral administration. They say people rarely react to a 70% solution. Oral dose can be anywhere from a few drops in water up to 1 teaspoon. Low dose and work your way up. So systemic or body-wide conditions may require oral DMSO. So it's fantastic if quickly applied after traumatic injuries, stroke, or spinal injuries. Literature talks about things like heart attacks and strokes. One could apply it over the chest region. Applied topically to the perineum to help with prostate enlargement. Gastrointestinal disorders or ulcerative colitis or duodenal ulcers, supposed to be amazing for ulcers. It was approved as an official drug for interstitial cystitis, sometimes used with a catheter into the bladder. So DMSO is remarkably effective at stabilizing refolding proteins. This allows it to treat a variety of untreatable genetic disorders and conditions characterized by abnormal accumulation of misfolded proteins in the body. Things like amyloidosis or chronic deposits of excessive contractile collagen. They mentioned sclerodoma and conditions where the body actually starts to turn into, the soft tissue starts to turn into bone. So I think this gives hope to people with some of these chronic genetic disorders. Please read the articles and you will understand more. One can be limited by what one can say in these platforms. It has antimicrobial effects. It's supposed to be one of the safest pharmaceutical products in existence. It's very effective at treating pain. It's supposed to be very helpful for insect and animal bites. I haven't experimented with that yet. Frostbite. Severe burns are supposed to be definitely helped by it. It's supposed to relieve sunburns in 10 to 30 minutes. It's been found to prevent damage from radiation therapy for people who get the big C condition. Arthritic disorders, rheumatoid arthritis. Dispersion of clumped blood cells, which can help explain why it's good for circulation. Can prevent blood clot formation in the body. Could be a great antidote for people who perhaps were forced to get the V and not to their liking and want to have an arsenal of things to help keep their blood circulating properly in the body. There was an ancient Chinese doctor in traditional Chinese medicine, and he said all 10,000 diseases at the time he could point to were a result of stagnation. And stagnation means poor blood flow or blood supply in the body. It's estimated that if you took the entire blood vascular system, it ranges from somewhere in the range of 80,000 to 100,000 miles, like 3 to 4 times around the equator. That's how important our circulatory system or the river of life for our body is. Think of it for scar tissue. So, and anywhere you've had surgery, great for post-surgery, as we talked about. It's supposed to be quite helpful for asthma, helping to reduce the dose of harmful medications. Sometimes making allergies disappear. Neuromuscular conditions, read more of this yourself. So due to its protective qualities, DMSO's toxicity is extremely low. It's been subject to a large number of animal studies and some human studies also. They took 78 prisoners over the course of 14 and then 90 days, applying 1 gram per kilogram to their skin, over 3 to 30 times the maximum amount of DMSO typically used. Then they were subject to an extensive battery of toxicology tests, all which showed DMSO was safe. There's never been a death linked to DMSO. Can be very helpful for varicose veins, according to the literature. You could apply this externally in the form of gel to the area. It's supposed to strengthen and tone the blood vascular walls. Additionally, a study attempted to model atherosclerosis by overloading rabbits with dietary cholesterol. Found that oral DMSO reduced the eventual atherosclerosis by 30 to 40% and had the accumulation of cholesterol in the tissues. I listed about 6 different reference articles, which are fantastic, by a Midwestern doctor on the forgotten side of medicine under the Substack newsletter. The experiment is on. Please share your results. I'm very excited about the possibilities. Glad to be using it myself. Have a wonderful day.